So while encountering the radiology, we have to use some of the specific term. So we'll be starting with the MRI terminology. So whenever we'll be using the MRI terminology, we'll use the word intensity. So intensity is for the MRI terminology. So when describing the most MRI sequences, we refer to shade of gray of tissues or fluid with the word intensity. And with respect to the intensity, it can be used either as an absolute term or it can be used as a relative term. So when we'll be using the intensity as an absolute term, we will use as either high signal intensity or low signal intensity or intermediate signal intensity. So high signal intensity would be something that is white or bright. So either we'll use the word white or bright, and it will be expressed in the absolute term as an high signal intensity. And low signal intensity means it should be either black or dark. And intermediate signal intensity would be similar to the gray type of color. So high signal intensity would be bright, low signal intensity would be dark. And when we'll be using the relative term, we often use as hyperintense, isointense, and the hypointense. So iso means the same brightness when we are comparing with an object or with a substance. And hypointense means it should be darker or black. And hyperintense means it should be bright or it should be whitish in nature. So either we will use high signal intensity or hyperintense, or low signal intensity or hypointense. And let me make another clarification for you. So you just need to remember whatever is written in this PDF. So anything else, whatever I might discuss, they are solely for the purpose of concept and understanding. So just try to remember, try to memorize whatever is there in the PDF. So can anyone tell me the neurological indications of cranial MRI? What are the neurological indications? When we should go for the MRI? The gross indications? Yes, Dr. Naman.
Multiple sclerosis.
Yeah, we can go for multiple sclerosis. Other than multiple sclerosis,
we can do an
transverse myelitis.
Yes, also in case of transverse myelitis. So we can remember us in for the detection of vascular pathologies like either ischemic stroke or hemorrhagic stroke, or AVM or aneurysm or venous thrombosis. So with respect to the vascular origin, ischemic and hemorrhagic stroke, AVM, aneurysm, venous thrombosis. And with respect to the venous thrombosis, it encompasses all types of the CVST, cerebral venous sinus thrombosis, whether this is superior sagittal or transverse. And other than vascular, also in case of tumor, and the tumor will be both primary CNS tumor as well as the metastatic tumor. Then we can also go in case of infection like cerebral abscess, or if there is any inflammation like cerebritis or encephalitis or meningitis. Then some of the inflammatory or demyelinating condition like multiple sclerosis or sarcoidosis. And you need to remember one thing very clearly: the CT scan does not detect the demyelination. So in any demyelinating condition, you should go for the MRI. So next one is the trauma. You can in case of epidural hematoma, subdural hematoma, or contusion. This type of epidural or extradural hematoma can also be seen in case of CT scan, but we can also go for the MRI. Then also the hydrocephalus as well as the congenital malformation. So vascular, tumor, infection, inflammatory, demyelinating condition, trauma, and the hydrocephalus. So can anyone tell me the limitations of MRI? Some of the limitations.
So it takes a long time to do MRI, and the patient is supposed to lie still.
Yeah,
So
very good. So MRI requires the prolonged acquisition time for the production of images. So MRI is not suitable in the acute emergency condition, and this is one of the biggest limitations of MRI. And when we compare between MRI and CT scan, so remember two conditions. In case of acute hemorrhage and in the detection of bony injury, the CT scan is superior compared to MRI. So in case of acute hemorrhage and for the detection of bony injury, the CT scan would be superior to MRI. And both CT scan and MRI, both of them are subject to the motion artifact. So what may be the contraindication, relative contraindication to MRI?
Metallic walls are not compatible
Implant.
with
Yes, go on, implant.
Metallic prosthetic, any metallic prosthetics.
So if there is any implanted device or metallic device like the pacemaker or aneurysm clip, or if there is any cochlear implant, or if there is any artificial heart valves, also in case of intraocular metallic foreign bodies. And also in case of unstable patient, in case of emergency patient, you cannot go for the MRI. And pregnancy is a relative contraindication. You can go for the MRI in case of pregnancy, but unless this is absolutely needed, usually the MRI is avoided and CT scan is usually contraindicated. And also in case of severe hesitation, or if the patient has features of claustrophobia, then also in that case, it is very difficult to go for the MRI. But patient with severe hesitation or with the features of claustrophobia, we can go for the anesthetic assistance, and afterwards we can go for the MRI. So we have already discussed one terminology, that is the intensity with respect to the MRI. So when we'll be interpreting the MRI report, we need to learn some other terminologies like what is meant by a lesion in the MRI.